Okay, so this presentation is based on the pandemic politics research that I've been doing with colleagues at the universities of Strathclyde, Glasgow, Newcastle, and Royal Holloway. And essentially, this is a very relevant topic for understanding crisis communication. Because when we're talking about crisis communication, we need to think about how governments shape their responses to crisis. And the significant dimension of what we've been doing is to trying to understand how people, particularly in the UK, have felt about the crisis measures that have been put in place as a result of COVID-19, with a specific interest in the social distancing measures that the government introduced during the pandemic. And this is a relevant topic as well because the word framing in this title is a fundamental way of thinking about public policy and politics. When we think about the framing of something, it's about how a problem is defined and who has the power to define the problem and the potential solutions. So the word framing is another way for describing the process of defining a problem. Okay. Can I just ask, if you're not on mute, could you please put yourself on mute because I can hear some background noise. Okay, so let's just run through some of this research and get to give you an insight into what we've been doing. Okay, I'll just move the slides along. So from a fundamental point of view, it's important to know that public policy is made up of a series of dimensions and stages. And one of the ways in which you might try to understand public policy processes is through understanding the policy cycle. Now, the policy cycle is what we call a heuristic, which is a model or a kind of approach, an easy approach in some ways to understand policy decision-making and process. Now, one of the things to bear in mind from the outset is that public policy is a phenomena, and every public policy has its own context. Not all public policies are shaped by the same actors or have the same context that surround them, because there can be fundamental differences between different policy areas. So, for instance, a policy area looking at health versus a policy area to do with foreign policy or defence will be profoundly different from each other because they have different objectives and there's different power dynamics that surround them. But this policy cycle framework is a way to understand policy making from a more simple perspective. And really what you've got here is a series of different stages whereby you've got policy formulation at the top, whereby the policies are the options are created to think about how to actually create a new policy and what to do. The decision-making stage is about actually executing what you decide to formulate and putting it into practice through policy implementation. And after policy implementation, there's an opportunity to evaluate the success or failure of your policy. Now, a key dimension is the agenda setting stage before policy formulation happens. So if you have the power to set the agenda in public policy, you're quite a powerful entity. So there can be a number of different sources of influence that set the agenda. It could be politicians themselves, it can be the media, it can be industry. Often the agenda is shifted in light of a crisis, because a crisis can open up opportunities for new developments to take place and new ways of thinking that perhaps you may not have thought of before, because a crisis can be a destabilizing event. It can be a destabilizing series of events which allows policymakers to think differently about the future. And you'll notice at every stage in the policy cycle, there are actors that influence the process. So that's really where complexity comes in, because it's not as simple to say that policy formulation then automatically leads neatly to decision-making and then implementation and so on, without there being influence being made by actors outside of the policy system or even within the policy system. So it's important to say that this is a very simple view of policy making, and it's far more complex. But what is the case is that the agenda setting stage has an impact on everything else that will follow from a crisis, from a policy. So if you define a problem in a certain way, then that will have an impact on everything else that you do along the cycle. So for instance, if, just take a very different example, if in your country there was a big drugs problem, too many people taking drugs and too many people dying of because of taking drugs, policymakers might look at that problem from different perspectives. One might be that they think that the problem is based on poverty within a country. Poverty can lead to crime, crime can lead to ill health, poor behaviours, drug taking, and so on. Someone, another person might frame that issue as a problem of personal responsibility, people not taking enough responsibility for their own well-being, rather than looking at the more structural problems around poverty. Or it might be that you take a subsection of what we've talked about and say, well, some people might think it's actually about crime rather than health. So there's different ways in which different actors or stakeholders might view a problem. How they define the problem can have significant implications for behaviours and what comes next. So the reason I'm highlighting the agenda setting stage is because the framing of public policy is heavily associated with that agenda setting process. So how you frame something is the same as setting the agenda. Okay, so that's the kind of theoretical or contextual landscape of the work that we were doing on this research to understand how framing has an impact on people's behaviour and public attitudes. So, Wayne Parsons, he talks about this idea that problems involve perceptions and perceptions involve constructions. So that plays to what we're seeing here, is in that perceptions of how to solve problems will often have an impact on what you construct. So how you construct a problem can be quite a social process in a sense, because you're a human being. We all have different values, different ways of looking at the world, which involves a degree of construction of an issue. So Wayne Parsons kind of highlights on this when he's talking about agenda setting. He says, well, problems involve perceptions and perceptions involve constructions. We're constructing a solution. We're constructing a series of responses to deal with an issue. I would encourage you to engage with Murray Edelman's work as well, because that's important in terms of developing what he would be aligned to, which is a constructionist approach based on theories of language. So in other words, constructivism is about how you bring your own values and interpretations to construct a reality about what's going on. It might be that your view of the world has a particular impact on how you construct the problems that have to be dealt with and the solutions that can follow. For Murray Edelman, language is key to framing problems and the potential solutions. So Murray Edelman talks about the importance of political language, this idea that language is so important for shaping behaviours. The language you use, how you potentially stigmatise, how you perhaps elevate an issue, the selectivity of the language you use can have an impact on how people define a problem and see a problem. And that's very important now. So, even in this modern world, politicians are being called out a lot of the time about the language they use and don't use. Are they being inclusive? Are they not being inclusive? Are they marginalising certain groups through their use of language? Are they actually using the appropriate language for solving the problem at hand? There's lots of debates about that during the COP26 conference recently about how to tackle climate change. The language that politicians were using was studied very carefully by lots of people, including the media, to see whether or not they're actually taking the problem seriously, or indeed if they recognise the multiple dimensionality of the solutions that are required to deal with something like climate change. So language is key, according to Edelman, and because that has an impact on how you frame something and the behaviours that result from that. This is really in the realm of what we call sociological approaches to understanding public policy. There's an idea called symbolic interactionism that you might have came across in the past. Now, symbolic interactionism is really about how symbols employed through communication can shape our understanding of the world. And in some ways, humans recognize symbols and attach meaning to them. You know, the symbols that perhaps so for instance, if you go to the United Kingdom and if you're interested in the royal family and the monarchy, the palaces themselves are a symbol. They're a symbol of a monarchic system. They're a system. They're a symbol of a type of country, a type of state, and that can have an impact on how one views their system and understands their system and attaches meaning to them. If, for instance, you are walking through Glasgow and in Scotland and you see all the different university buildings, you might say to yourself, well, this is a place that values education, higher education. So we understand our environment through symbols. And that's very important for framing, because if we're talking about crisis communication, the mechanisms of language and even the ways in which you might see posters on the wall, you know, or in your GP surgery, or it might be, you know, in newspapers about stay at home, protect the NHS, wash your hands, you know, social distancing. These can attach meaning to things and it can shape behaviour. So symbolic interactionism, or even more sociological approaches to how we understand public policy, is very relevant for communication, because we use communication in different ways. Language is important, images are important, structures are important. So it's very interesting to look at how framing has a relevance here for more sociological interpretations. And of course, like we said, it's not just politicians, but the media that are also key as an agenda setter. And public attention can be shaped by such actors. It's very much the case that the media can elevate a problem which draws the attention of the public. Having said that, there are other academics out there who have written about this. So, for example, somebody called Anthony Downs in the 1970s wrote about the issue attention cycle, which is that you can't always rely on the public's attention being on one thing all of the time. It might be that the public are aware of a problem for a short period of time, and that could be as a result of a crisis. But through time, the attention can wane and deplete over time. A way to maximize their attention can be through the media and communication channels, but it's not to say that the public's attention is always stable all of the time. It can fluctuate depending on events. So academics like Anthony Downs, people like Brian Hogwood, Guy Peters have written about how public attention can fluctuate. But when public attention on something is very high, that can often stimulate institutions and government to think about changing policy and amending what they do. So public opinion, therefore, is very important for crisis management. And it's very important for public policy. And that's why we looked into this study. That's why we decided to do this study, to look at the impact of crisis framing on public attitudes towards addressing the crisis, the COVID-19 pandemic, but also particularly around how framing can influence behaviour to do certain things, such as social distancing, such as obeying and adhering to the government's language around controlling the pandemic. So that's where we'll turn now to look at some of the specifics over what we did. So it's fair to say that most governments, including the UK, experienced high levels of trust and support for crisis measures at the start of the crisis. And then when I say the start of the crisis, I'm referring to early 2020. But there is such a thing as the prevention paradox. And you can always do some more reading on the prevention paradox. But essentially what it boils down to is that the policy measures that governments might want to put in place to have an impact on public health can be quite difficult to implement. So those measures that might have the highest impact on public health can be difficult to implement if individuals perceive there to be a low probability of them themselves being affected by a disease or a health problem. So basically what we're saying here is sometimes addressing major health problems requires those that might not necessarily think they are going to be affected by it to change their behaviour too, so that it protects other people and it has a big impact. So there's something called the prevention paradox. It's quite difficult to implement major public health policies which will have maximum impact if individuals themselves don't recognise the impact that it might have on them. There are other challenges, particularly in terms of the control measures for the pandemic. It could be that people have fatigue when it comes to basically adhering to what the government have asked them to do. Social distancing fatigue, the impact of political polarisation as well. It might be that some sections of society recognise that the greater good is important, that having a more community approach, a societal approach to cooperation is more important. But then there are others on the other side of the political spectrum which think that actually that's, gets in the way of individual freedom, and the individual should be the people who dictate their own lives, and it shouldn't be for the government to perhaps tell them what to do. So you do have that political polarisation that policymakers have to wrestle with. It can also be that the public might see policy failures, contradictions and scandals as an opportunity to regard the government as not providing leadership, a fair request for us to change our behaviour because of their behaviours. So is it the case that policymakers aren't always the most moral people? So therefore, why should we be? So there might be that public perception out there. How do you wrestle with that as a policymaker? There's also conspiracy theories as well that can take hold via social media and others, that perhaps things like the vaccine is a way to control the population. I remember at the beginning of the pandemic, there was lots of people talking about how the vaccine was there to put a chip into our bodies so the governments could monitor our movements and all of that nonsense. So there's lots of conspiracy theories out there, and that can have an impact on people. It can have an impact on how people feel about adhering to public policy. There can also be a populist revolt against what they call the overeducated. So if, for instance, you've got the population in the UK, or some of the population, that see those in power, politicians, as those perhaps being, in an elitist position, they don't look like you, they don't sound like you, so why should you behave in a way that they expect you to? So there can be a revolt against what they call the overeducated, or perhaps those that are in more elite positions. That can have an impact on whether or not people will adhere to crisis measures. And there is an emerging literature on what we call support compliance. So the main focus being on personal circumstances. So, do personal circumstances have an impact on the extent to which you will comply with government? It could be about your own health situation. Would it be that your socioeconomic position will determine whether or not you will comply or not? Can you afford to comply if it requires you to take less money because you can't go to work, because you have to stay at home, because of the crisis management measures? Those are the types of things that are being written about at the moment. And also there are other variables as well. And it links to what we said earlier in terms of, can it be that trust in politicians has an impact on whether or not you're prepared to adhere and accept what they're asking you to do? Therefore, framing is key to crisis management. But the actual process of framing and the impact of framing on public attitudes to adhere and accommodate crisis measures has received very, very little attention within the academic literature. So that's why we have been looking at this issue. Okay, I'll just move along now. So whenever there's a complex policy issue, and it could be like a pandemic, it's fair to say that crisis narratives are important. And because they're very important, because there can be lots of different voices. and different stakeholders that want to frame an issue in a certain way. So Entman, who's written a lot about framing, talks about framing contests. So there's different contests around frames. It might be that there's different groups of people that want to define a problem in a certain way, and it's like these different definitions are kind of competing with each other. And really what these framing contests concern is the nature and severity of a crisis, what the causes are, the responsibility and blame that should be attached to individuals for its escalation or occurrence in the first place, and perhaps the framing contests around the appropriate way to respond and remedy the situation in an affordable way, or even within a pragmatic and doable way. These are very important when it comes to crisis. And narratives are essential for unpacking what actually drives public support, or how stable or volatile it is, on how it may develop over time in a rapidly changing environment. If you want to see more I'm going to come on to talk more about this study, but if you want to see other bits and pieces around this research and some of the work that we've been doing and some blogs, have a look at pandemicpolitics.net, because that's where our group has been putting our outputs. And I should say that the key article for you to read for this study is on the Moodle site. So on the Moodle site, you'll see under this week's topic, the first article that you're asked to look at is by Kariotis, Connolly, Collignan, and so on. And that's the article, What Drives Support for Social Distancing, Pandemic Politics, Securitisation and Crisis Management in Britain. We've recently published this work within this journal called European Political Science Review. It's one of the biggest, it's a very highly reputable journal. It's one of the biggest journals in the world in political science, and it's open access, which means anyone can access it without needing a password. So you just click on the link that you've been given to the article, and that article details all the elements of what I'm talking about just now. It gives you the full study in that paper. So I hope you'll take the time to read that paper, because it's a very it summarises exactly what we're doing here and what we're looking at. Okay, let me just get back to what I was doing. Okay, so next slide. I'll go on to. Just the things is loading. Right, so go back. Sorry, it's just taking a moment to, I think. Right, so the research aim for the work was to consider what the UK population, a representative sample of the UK population, how they felt about their support or otherwise for managing the pandemic. So one of the research aims was to ask, to what extent do you support or oppose the following measures to manage the pandemic? Allow people to leave their homes only for essential reasons, work, shopping, medical appointments. And you can see that there was strong support in terms of supporting the measures. As you can look at down the distribution on the table. And basically what this table tells us is there was strong support, or at least strong support for the measures that the government put in place at the early stages of the pandemic. The research question overall was to identify the drivers of support for social distancing in the UK and explore the explanatory power of different models. So basically different frames with the dependent variable being support for social distancing. The research design was made up of crisis management theory, enriched with insights from political behaviour and security studies using mixed methods. So the framing literature was fundamental for shaping what we're doing and shaping the study. The mixed methods approach was to use the survey of 2,500 people within the UK, controlling for different categories of, male, female, sex, age, all those different things. And the mixed methods came in terms of using the survey, but also using the literature and the ongoing response by the government at the early stages of the pandemic as a qualitative element to generate the frames and to understand the response by government. So we used newspaper articles, we used government publications and so on to interrogate what the key narratives were emerging from them in terms of how to address the pandemic and the ways in which crisis measures should be promoted. So it was that. Okay, let's move on here. It's a little slow, but hopefully it'll get there. So what we did. So as I said, it was a thematic analysis looking at key frames. That was where the qualitative element to understand what the key frames were to emerge. A representative sample of the UK population, over 2,000, administered by Identible. I said 2,500 a minute ago. It's actually 2,100. The survey took place between April the 10th and April 15th in 2020, which was actually week 3 of the national lockdown in the UK. It could be seen as an extreme case study in a sense because in many ways the UK didn't fare well in terms of a comparative response. There was quite a delayed response to the pandemic in the UK, significant deaths, and in some ways you could look at the UK as an extreme case study because we locked down at a relatively late time, and even though scientists were saying we should have locked down far earlier. So this gives you an extreme case study of what it can be like in terms of when a crisis is actually already underway and well into the crisis in many senses with regards to how the UK population feel about crisis measures. But like any research, there's always limitations, and that this only captures only a snapshot of attitudes during the early stage of the crisis, and what you could regard as a time when there was an emotionally charged set of circumstances naturally associated with the crisis. And essentially what we're doing here is presenting you with the results of the agenda setting approach. Okay, so what are the explanatory models? The explanatory models here refer to the ways in which we can use different interpretations to understand the extent to which the population will obey crisis measures or otherwise, and also what's important to them as well. So what would be important for shaping public attitudes? Well, one dimension is health. So one model is about thinking about health vulnerability, the concern about catching the virus, concern about your family, concern about access to medicine. So in some ways, the health dimension can influence your attitudes to whether or not you obey the crisis measures or not. There can also be an economic perspective where you've got sociotropic and egocentric interpretations, which means that you might be in a position whereby you're concerned about the wider economy and the economy of your communities, so the sociotropic perspective. Or it could be that there's a more egocentric dimension whereby you're worried about your own economic welfare, so that can shape your attitudes. Relative economic vulnerability, your concern for family responsibility, and general economic concerns are relevant here for how the economic interpretations can have an impact on whether or not you subscribe to the crisis measures implemented by government. And indeed the political model as well. To what extent are you informed about politics? Do you trust the government? Are you an ideological person? Does ideological perspectives have an impact? Your degree of self-efficacy, the extent to which you're resilient in the face of political change. These can have an impact on the extent to which your attitudes are shaped in relation to obeying or otherwise crisis measures. So the framing contest is really about trying to understand the contradictory information and understand what are the competing frames that are happening out there in terms of shaping your attitudes. So any crisis, and this is true, I mean, any crisis typically generates fast and contradictory information, which form competing frames concerning its nature and severity, the responsibility for its occurrence or escalation, and the appropriate response and sacrifices it requires to curtail its development. So again, we're referring to Entman's work here, very important. So there's three main elements here. What is the nature of the crisis and how severe is it? Who's responsible for its emergence and escalation? And what is the appropriate treatment and recommendation? I don't know if you can see at the bottom of the slide there, but that is a quote saying the main currency of crisis management, short of pure coercion, is persuasion. So basically persuasion, communication is very important for shaping public attitudes and behaviours. I'll also share the hard copy of these slides on the Moodle site as well, so you have them too. Okay. So the first element of the study was to map the key debates in the public debate and trace their origin and salience. The literature points towards top-down influences. So in some ways, the government can influence us. The media can influence our behaviours. But our design doesn't make causal inferences between what a government says and what people do, or how people react. It's more about understanding the general public attitudes towards crisis frames. So we're not overclaiming this research. We're just giving you an analysis of what our survey turned out to look like. The thematic approach that we undertook, the qualitative element, came up with these different dimensions. So there was a degree of fatalism and trade-off. So we're looking at the responses of Boris Johnson and the language that he was using. Again, going back to Murray Edelman's work that we talked about earlier, how political language is so key for shaping discourse and creating discourse. One of the elements was this idea of fatalism and trade-offs. So Boris Johnson was on a popular TV programme on the 5th of March before the lockdown, when they said that one of the theories is perhaps you could take it on the chin, so you could take the pandemic on the chin, take it all in one go, and allow the disease, as it were, to move through the population without taking as many draconian measures. I think we need to strike a balance. So that's when the narrative was more about there being a herd immunity. That was one element of the discourse. Then, not long later, a few weeks later, you had the Prime Minister saying the country will get through this epidemic. That's the little bracket there, say sick, is to represent the fact that that was his mistake. It was actually a pandemic, not an epidemic. Just as it has got through many tougher experiences before, if we look out for each other and commit wholeheartedly to a full national effort, we're all enlisted. So there's almost a kind of warlike, a kind of view there that we're all in this together. We'll take a national response to it, almost bringing in a kind of nationalist framing to how we should respond to the crisis. So a slight change there from more of that kind of herd immunity position. Then, furthermore, later, in another quotation from the 16th of March, Prime Minister said, "We're all in this together. Measures are necessary in order to reduce the number of victims and fatalities and protect the NHS." That's when the more leadership narrative emerged, kind of top-down approach. Then you had another interpretation come from the Prime Minister on the 23rd of March, saying the biggest threat this country has faced for decades is essentially the pandemic. So again, taking it more seriously as time goes on. And then what you had was the creeping out of a crisis communication message. Stay at home, protect the NHS, save lives. That became the crisis communication message throughout the pandemic, and it started to form. But you can see over a short period of time, if you look at March, the 23rd of March, there's a real shift in narrative, a real shift in framing, in that it went from, okay, we can maybe just take this one on the chin, to this is the biggest threat we've seen in decades, and we have to take a very top-down approach. So there was a real change there. Then this narrative of stay at home, protect the NHS, save lives, led to the focus on personal responsibility, giving people positive incentives through economic incentives like the furlough scheme in the UK, and also this narrative of protecting the common good. So to save the NHS, save lives, it was really promoted, this narrative. And unprecedented economic steps were taken to keep the economy going. So that's when the Prime Minister started to say we need economic measures through things like the furlough scheme to maintain people's jobs and hopefully ensure that the economy isn't drastically affected, although it was affected, but perhaps it would have been more affected if people lost their jobs. And many did, of course, depending on the industries you worked in. But the economic solutions were seen as being very important by the Prime Minister. So again, quite a top-down macro. Okay. So where did our descriptive findings emerge? I mean, what were the findings from our public attitudes survey? So if you look at this slide, this refers to support for measures to manage the pandemic, and it's about the proportion of men and women that support or strongly support the measures. So if you look at the first one, that refers to allow the authorities access to mobile phone records to monitor our movements and whether or not we're leaving the house or not. Not a huge amount of support for that. But if you go to the other end, there's lots of support to allow people to leave their homes for only essential reasons. Okay. So people were accepting the message, understood the importance, and were willing or understood the importance of staying at home. And even if you go down a little to close all UK borders, there was still quite a drastic, acceptance of some drastic measures to address the pandemic. But actually, the further down you go, once we got into the realm of civil liberties around privacy, access to our personal information and things like that, that's when the support started to drop. So for governments, what this tells you, if there's a lesson to come out from this, is that policymakers have to be aware that any interventions to address civil liberties are not likely to be as accepted as perhaps those which are more about you taking your own personal responsibility for staying at home and taking your own measures in light of the message by government. So that's one element. The main worries, personal concerns, main worries during the COVID-19 pandemic, main concerns was that people were worried about a member of their household or perhaps catching COVID. They were less concerned about the economy running into the ground to the point where they couldn't access food, or even things like family responsibilities didn't really register significant in terms of personal concerns. It was more about health issues and fear for their families, fear for themselves, and perhaps even getting access to the right medicines. So that was the main personal concern that we saw. So the kind of framing contest here around the nature and severity. So what you found was that in terms of the concern about the pandemic in the UK leading to mass unemployment, the breakdown of the NHS, social unrest, Britain becoming a police state, the main dimensions here were around the concern around the public being concerned about mass unemployment and widespread economic hardship. You can see there that the concern and very concern levels in both domains highlight that significant feeling. There was concern as well about the overriding of the NHS and the overcapacity in the NHS, which gives you an insight into perhaps how the effectiveness of the stay-at-home message was to protect the NHS and save lives, and that message did seem to register, and that there was concern that perhaps having too many people admitted to hospital would mean that the NHS would collapse. So that message was really getting through in some ways and shaping attitudes. Again, second context around blame attribution. So who's to blame for this? So the two categories here, responsible or extremely responsible. What is overwhelming is that the attitudes of the public was that the individuals to blame at the early stages of the pandemic for its spread and its continued spread was actually individuals themselves. So people not following the social distancing measures. There was some support for this idea that it was the Chinese government that was responsible, and each and every one of us. So those first three are the key ones, in that, you know, the government put out this message that it's about individual responsibility to save lives. That did register. Each and every one of us, that also registered. But what you had here as well was a narrative that was emerging in terms of the othering, blaming other countries, and particularly the Chinese, in terms of the source of the pandemic. And some of that could have been influenced by some of the narratives from Donald Trump at that time. There was also those within government as well that were quite open about the feeling that, you know, the source was from China, and that there was blame to be attached from that. But there was a bit of a global narrative, particularly perpetuated by the US government under the Trump's administration about that at the time, which could have influenced public attitudes in the UK too. But overwhelmingly, really what we're talking about is that the people to blame were each and every one of us for the spread of the pandemic. And if we didn't adhere to the measures by staying at home, implementing social distancing, then it would be our fault for the pandemic overriding and getting out of hand. So that was an interesting dimension, in that personal responsibility was seen as key. Remedies and trade-offs. So what you've got here is different categories over disagree, neither disagree or agree, or agree. So what you've got here, if you go to the bottom, it says the measures taken by the government to combat the coronavirus pandemic are necessary to prevent a major national catastrophe. Overwhelmingly, that was certainly put out there as a statement that one would agree with generally, that the government's measures were necessary and reasonable. There are also elements here around the economic burden of the government measures to contain the coronavirus is not distributed fairly to all citizens. There was a feeling of a degree of inequality there as well, particularly around the economic burden. So some individuals could absorb the fact that they perhaps had to work less, or the other people, and also those that didn't qualify for the furlough scheme as well. So perhaps there was an inequality there as well. We know the situation within the arts community that were severely affected. So there was a perception that, you know, although economic measures were in place, they weren't necessarily shared across the board in a fair way, and that some people can absorb economic turbulence more than others. So that was recognised as well. And also some support for the fact that the pandemic will accelerate political and social transformations for the benefits of humanity, which is quite interesting. Quite a lot of people neither agreed or disagreed with that. But I think what that really talks to is that there's a general recognition that crises can lead to change, and it can be an opportunity to do things differently. What those particular things are subject to further research, but these are interesting dimensions that came out from our survey. Okay. One of the elements, again, is about public health and economic considerations. And what you found here is that there was generally the view expressed that minimising the numbers of deaths should have priority over economic concerns. There's a fair distribution here in terms of the different responses, quite interesting, but generally that was the case, that minimising the numbers of deaths was very important. Also a trade-off between public health and civil liberties considerations. Again, what you found was that public health should definitely have priority over concerns about civil liberties. It'll be interesting to see how that pattern changes over time as the pandemic continues. But at this time, at the height of the pandemic, at the early stages, what you found was that generally individuals felt that public health concerns definitely overrode concerns for civil liberties as a result of the crisis measures implemented by government. Interesting dimension here as well is around the role of science. So 27% considered that science had done more harm than good to the response, and 25% considered that we believe too often in science and not enough in feelings, which was very interesting. And that really calls into question the impact of what we have talked about in the past is around the post-truth society and whether trust in scientists has waned over time because of the recognition that sometimes that scientists don't always agree with each other. Science can also be politicized, but also generally, again, referring back to the Trump administration, a lot of the narratives from the Trump administration was that we trust too much in science, that we live in a world of post-truth politics. We can't trust the scientific community. We should trust politicians instead, which is dangerous, of course. But what you found here is that there's three categories of individuals being not sure, or they might be that they recognise the scientific causes of the pandemic, or they recognise that conspiracy theories were the causes of the pandemic. But interestingly, the attitudes of the public were more in line with the scientific interpretations, and that the pandemic came about due to a multi-dimensional approaches in terms of come from animals, human living habits, and so on. But there are some interesting issues to explore further in future research, is the extent to which science and scientists are trusted in terms of the narratives they give out in the event of a crisis. So what predicts support for the crisis measures to social distance? Concern over mass unemployment. People not following the measures. TINA means that there is no alternative. There is no alternative, so measures are necessary. Crisis is an opportunity frame, so crisis can lead to opportunities for change. There are trade-offs, health over economy, and civil liberties, so health dominates. Trust in scientists in advising the UK government is an issue that needs to be looked at more. But what predicts opposition to social distancing? Concern over social unrest, fatalism, in other words, nothing we can do to contain the spread. Health concerns, and again, the prevention paradox, having a prior COVID-19 diagnosis or the absence of personal health vulnerability. So if you don't think you're going to be vulnerable, it might be the case that you don't adhere to social distancing as much as someone that is more vulnerable. There are political factors as well that can predict opposition to social distancing, such as low personal self-efficacy, distrust in government, right-wing ideologies which focus on individual liberty. Some demographic factors as well, so younger age groups, relative economic vulnerability, juggling responsibilities of life. We also found that those from BAME ethnic backgrounds tended to be more opposite to opposed to the social distancing measures more. Males, more than females, tend to oppose social distancing. Males, they kind of demonstrated more of a sense of invulnerability compared to females. But again, these are different categories that deserve future research. Clarity of message is seen as important. So this goes back to what we're talking about in terms of crisis communication. Having a clear message can shape public attitudes. Stay at home, protect the NHS, save lives. But then that moved on to something called stay alert, control the virus, save lives. So the narrative has slightly changed from that lockdown mentality to more one of personal responsibility of staying alert. There's questions about the impact that will have over time. So the question for the seminar was, what does the COVID-19 pandemic tell us about the challenges of public health communication as part of the crisis management process? Well, crisis management, more than anything depends on successful framing, which both domestic and international factors impact on. The UK government was successful in its communication strategy early on, but the message has since got muddled by that change from stay at home to stay alert. That can start to get muddled. The overall picture raises concerns about the prospect of compliance with measures through time. We're currently researching a follow-up study to this. We took a survey a few months ago, and what we're going to do is to compare this survey with the one that we're analysing at the moment to track changes in public attitudes and the ways in which these framing contests have changed over time. Thank you. Okay, so I'll stop recording.